I have verified the physician's orders to extubate the patient. I'm also going to do closed suctioning. I have checked his chart for any significant findings. I have washed or sanitized my hands. I'm going to put on my gloves. I've gathered my necessary equipment, which includes the closed suctioning, the vacuum system set to -120 to -150, corrugated tubing, hooked to a large volume nebulizer with a mask to supply the patient with oxygen to prevent upper edema after extubation. I have the Yankauer attached to the suctioning system, and I have a standby intubation kit, which includes the laryngoscope, Macintosh blade, a stylet, an extra ET tube, a CO2 detector, and a 10 cc syringe. I also have on standby a small volume nebulizer with racemic epinephrine in case the patient gets stridor, and that needs to be administered along with an anti-bag and a face mask. Okay. Hi, Mr. Doe. My name is Nicole. I am here to perform suctioning and extubate, remove your ET tube from you. So I would check the patient's identification, it matches, put on a pulse ox so that I can watch his stats, his saturation level, his heart rate, his blood pressure, in case it drops, could cause vasovagal stimulation. Mr. Doe, I'm going to be suctioning and removing your ET tube. Can you hear me? Make sure the patient's off the weaning process. He wiggled his toes. I'm going to go ahead and perform some suctioning. So before the inline suctioning, I'm going to put him in the high Fowler position now. Okay. So I would take my Yankauer and suction along the ET tube to remove any secretions. Okay. I also would have this chuck, put that on there, hook up that. This should take no longer than 15 seconds. 5 in, 10 out. Okay. I would then Mr. Doe, I'm going to take out your ET tube. Are you ready? I will loosen the ET tube holder. Okay, Mr. Doe, when I say so, take a deep breath in. Upon inspiration, I will deflate the cuff and pull the ET tube out. Okay, ready? I would then ask the patient to cough to release any extra secretions and resuction. I would then check his blood pressure, heart rate, and O2 level, and then I would put on the mask to deliver an FiO2 as indicated on his chart, which is set at 40. I would then monitor the patient and listen for stridor with my stethoscope. If stridor is present, I would administer racemic epinephrine. If the patient's in distress, he may need to be re-intubated. I would then wash my hands and put any data on the patient's chart.